Additionally, it is important to avoid heavy, high-fat meals before bed. Try to eat your last meal of the day at least 2 to 3 hours before bed. This way, you give your body time to carry out complete digestion, further reducing the chances of nocturnal reflux. With these simple tips, you can considerably reduce your reflux symptoms, both during the day and at night. Small changes in routine, such as walking after meals and raising the head of the bed, can make all the difference for those suffering from the discomfort caused by this problem. These changes, although simple, help to balance the digestive system and reduce the return of stomach acid to the esophagus, combating the discomfort of heartburn and burning sensation. However, it is essential to remember that these tips can be extremely effective in mild to moderate cases of reflux, but are not always sufficient for those suffering from more severe symptoms. Seek medical help. When reflux becomes unusual, that is, it occurs frequently and interferes with your daily life, it is essential to seek guidance from a healthcare professional. Chronic reflux, known as gastroesophageal reflux disease (GERD), can cause serious complications if not specifically treated, such as chronic inflammation of the esophagus, esophageal ulcers, and even an increased risk of esophageal cancer. Therefore, a medical consultation is necessary for anyone dealing with persistent symptoms. Medical experts may recommend treatments that include specific medications, such as proton pump inhibitors, PPIs, antacids, or H2 blockers, which produce acid production in the stomach. These medications are key to controlling reflux long-term and preventing damage to the esophagus. In some more serious cases, surgical treatments may be indicated. Importance of correct diagnosis. Consulting a doctor guarantees an accurate diagnosis and the choice of the most appropriate treatment for each case. This is important because reflux can manifest itself in different ways, with symptoms ranging from heartburn to difficulty swallowing or lesser-known symptoms, such as chronic coughing and hoarseness. Each case must be assessed individually to ensure effective and safe treatment. Small changes in daily habits, combined with medical monitoring, are the way to alleviate reflux symptoms and significantly improve quality of life. When we treat reflux responsibly, in addition to avoiding discomfort, we prevent future complications. These tips were useful to you. Don't forget to subscribe to the channel. Share this video with friends or family who also suffer from reflux, because together we can promote greater health and well-being. The more people understand how small changes can make a difference, the better quality of life we can bring to those who need it. Small changes in daily habits, combined with medical monitoring, are the way to alleviate reflux symptoms and significantly improve quality of life. When we treat reflux responsibly, in addition to avoiding discomfort, we prevent future complications. These tips were useful to you. Don't forget to subscribe to the channel. Share this video with friends or family who also suffer from reflux, because together we can promote greater health and well-being. The more people understand how small changes can make a difference, the better quality of life we can bring to those who need it. How to end burning and discomfort naturally. Hello! Have you ever felt that burning sensation in your chest right after eating? Reflux is a common problem, but it can cause a lot of discomfort and even harm your quality of life if not treated correctly. When stomach acid rises into the esophagus, gastroesophageal reflux occurs. This acid irritates the lining of the esophagus, causing the burning and bitter taste you've probably experienced. Let's go through some tips to help. The first tip for controlling gastroesophageal reflux is directly linked to food. Adjusting what you come in, how much, and when you take it can be a decisive factor in relieving symptoms of burning and discomfort. Lighter meals. By opting for lighter meals, you reduce the burden on your digestive system. Heavy, fat-rich, and slow-digesting foods increase the production of gastric acid and pressure in the stomach, facilitating the return of this acid to the esophagus. Foods such as fried foods, fatty meats, and full-fat dairy products are major causes of reflux. Fiber, fruits, and vegetables. Fiber-rich foods like whole grains, vegetables, and fruits not only aid digestion, but also help control stomach pH. Fruits like bananas and melons, for example, are known to be less acidic and can act as natural calmers for the stomach lining. Vegetables such as broccoli, cauliflower, and carrots are also great allies, as they do not cause excessive acid production. Avoid large quantities. Eating excessively overloads the stomach, resulting in greater production of gastric acid. When the stomach is very full, the lower esophageal sphincter, a valve that prevents acid from returning to the esophagus, becomes more pressured, facilitating reflux. Eating smaller but more frequent meals throughout the day helps avoid this excessive pressure, keeping stomach acid under control. Furthermore, spacing out meals and avoiding eating too close to bedtime is also essential. Eating and going to bed immediately afterwards is one of the main causes of nocturnal reflux. This occurs because when lying down, gravity is no longer helping to keep gastric contents in the stomach, making it easier for acid to return to the esophagus. So waiting at least 2 hours after eating before bed can make a big difference. The combination of a balanced diet, rich in fiber and easily digestible foods, with smaller portions throughout the day, is a powerful strategy for controlling reflux and improving digestive well-being in general. One of the most effective strategies to prevent reflux is to avoid lying down right after meals. When you lie down right after eating, you lose the help of gravity, which normally keeps your stomach contents in place. When we are standing or sitting, gastric acid tends to remain in the stomach, which prevents it from returning to the esophagus and causing that uncomfortable burning sensation and heartburn. Walking or standing after meals. By standing or walking for at least 30 minutes after eating, you ease the digestive process. The movement helps speed up the passage of food through the stomach and intestines, avoiding the risk of acid being pushed up. There is no need to do intense exercise. A light walk is enough to promote digestion and avoid pressure on the lower esophageal sphincter, which is a valve responsible for preventing stomach contents from returning. This simple but powerful practice can bring great benefits to those suffering from reflux, as well as contributing to their general well-being. Walking after meals also helps with weight control, which is important as excess weight is another factor that can aggravate reflux. Extra pressure in the abdomen of people who are overweight or obese can force stomach acid back up into the esophagus. Nocturnal reflux and elevation of the head of the bed. For many people, reflux tends to get worse at night, especially while sleeping. This happens because when lying in a horizontal position, stomach acid has an easier time rising into the esophagus. A simple and effective trick to combat this problem is to elevate the head of the bed. By elevating your upper body, you use gravity to your advantage, keeping the contents of your stomach in a lower position in relation to your esophagus. The recommendation is to raise the head of the bed by 15 to 20 centimeters. This can be done by placing blocks or wedges under the foot of the bed in the part where the head is, or using specific pillows to elevate the torso. The important thing is to ensure that the guidance starts at the hips, and not just the neck, for the effect to be effective.